So when I do a forehead lift, I'm making incisions usually behind the hairline, and that helps to elevate the forehead. And the way I like to tell patients about it is that it's almost like we're taking the outer half of the eyebrow and we're turning it a clock hour upwards, or even a half clock hour upwards. That's all you really need in most cases to be able to get that definition and that rejuvenated look of the eyebrow and the forehead. When I do a forehead lift, I'm going behind the hairline, and so that incision is going to be in the hair. Sometimes after surgery, you can get hair loss around the incision. Scarring wise, you will feel that incision, but you may not see it long term because it is hidden behind the hairline, and depending on how thick your hair is, it might not be visible behind the hairline if you have thicker hair or some hair there. If you're non-hair bearing there, if you've lost your hair there, then the conversation about scarring becomes a little bit more of a difficult one. Second risk specific to a forehead lift, super important to remember. When we do a forehead lift, we're going kind of all the way down to the corner of the eyelid there in the eyebrow, lifting that area up. And in doing so, crossing underneath the most important nerve that helps you lift that part of the eyebrow. That nerve kind of goes from just in front of the ear to just above the eyebrow, right along there. That nerve can be injured during surgery. It's rare. It happens less than 5% of the time, and when it happens, it's usually a temporary injury that does recover. However, less than 1% of the time, you can get a permanent injury of that nerve, and what that would mean, unfortunately, is that the eyebrow would droop a little bit. So you have to understand, forehead lift surgery does carry that risk of nerve injury.